The delay in the issuing of test results by government-owned laboratories has raised concerns about the dilapidating state of public hospitals.
Things are not looking good with NHLS branches. More tests are actually prolonged more than the 7 days and end up being rotten, and you actually cannot analyze the specimens and end up being thrown in the dustbin.
Because no one uzela esinayela bewadini alahlekile wona wakawatholakala
alahlekile
bathi alahlekile udokotela sezona wow
udokotela uyilikazi.
A cutting-edge investigation has revealed that the National Health Laboratory Service is on the verge of collapse. The NHLS are state-owned laboratories responsible for testing medical specimens in public health facilities. Chris Hani Baragwanath in Soweto prides itself as the third largest hospital in the world. The hospital also arguably has the largest laboratory run by the NHLS. The laboratory tests medical specimens of inpatients and outpatients visiting the hospital daily. In addition to this, the hospital receives specimens from over 20 surrounding hospitals in Soweto. It is estimated that Chris Hani Baragwanath receives 20,000 new specimens every day. However, these are not tested and correctly stored within the stipulated time. Most of them are left unattended. They end up rotten and thrown in the rubbish bin as medical waste. A concerned health practitioner confirmed that there are problems with NHLS. We met in a secluded place.
So what's happening with our labs?
Things are not looking good with NHLS branches. As to oppose that, millions of South African lives are depending on their services.
Please unpack NHLS for us.
NHLS is a regulatory board which actually runs medical tests and specimens for the hospital or government hospital. It has branches around the hospital institution and providing services in terms of delivering results to health practitioners as well as patients. They are also responsible for pathology services such as the departments of hematology, your chemical pathology, your histology, as well as your microbiology where they diagnose patient. The standard operating procedure of the lab is that specific specimens are allowed to be kept within a 7-day period where they can be tested or retested depending on the clinician's request. But you'll find that more tests are actually prolonged more than the 7 days and end up being rotten, and you actually cannot analyze the specimens and end up being thrown in the dustbin and rejected on the system as either invalid, older than 3 days, or rejected. But you find the specimens were in the regulated time, within the time frame of the lab.
The practitioner says when doctors ask for the test results, staff cover up for the dysfunction in the laboratory.
Some of the famous problems that are always said to clinicians is that the analyzer problem breakdown, you are forced to say the invalid specimen or shortage of your results, and therefore you are cutting off the specimens of the system and you move on. And in that clause, the more the specimen is delayed, the more you cannot analyze the specimen because of certain analytes, or what can I say, discrepancies of results that need to be analyzed at a certain period or time. Doctors do not get the results formally and cannot diagnose their patients for treatment. You would find that a doctor cannot actually make a treatment or do surgery due to that forthcoming of results. So hence there's a delay, or you end up having patients that could actually fatally die due to that.
Early diagnosis and treatment of patients can save lives. However, the health practitioner alleges that the procedure used in laboratories is flawed.
Doctors have come with complaints, but nothing has been fruitful about it. There has been delays of misdiagnosis of results to patients. Doctors unable to reach a point where they are able to help or assist the patient due to the negligence of NHLS per se. It has overall happened with a number of years throughout, and also meetings to and fro and having back and forth, but no assistance or no avail. Let me make an example with Barrow Hospital Chemical Pathology Department, which actually runs a blood test, which was actually suspended with SANAS due to not having, they're actually running without accreditation, due to speculations of delayed specimens, specimens that have not been run within the correct time, analytes that are not correctly run, and negligence as well.
The South African National Accreditation System, an institution that issues operating licenses to laboratories in the country, has confirmed that the laboratory in Chris Hani Baragwanath Hospital is in a critical state.
So what could be the reasons for SANAS to suspend them?
The department has been riddled with delayed delivery of blood results, and hence disqualifies the accuracy of these results.
The health practitioner took us through the NHLS standard operating procedure.
This is a standard procedure. It's set up step-by-step instructions. It is compiled by an organization to help workers carry out routine operations. SOPs They mainly aim is to achieve your efficiency, your quality output, and performance, while also reducing failure to comply with the industry regulations. So in this case, the regulation board could be SANAS. Basically, the standard procedure, it states the specimen storage and stability. And in one of the complainants or one of the speculations is that the specimens were not regulated or they were tested after 7 days. But the lab disputed it, that obviously the procedure or the standard procedure of the lab is that the specimens are kept for 7 days and processed. But this says the specimens are stored in the laboratory for 7 days after processing, meaning after processing. So why would you keep a specimen in the lab before due reasons that you don't process the specimens? And what happens if it's actually urgent specimens?
This means that urgent specimens for HIV, TB, cancer testing, and others are included in these samples in the videos.
There's a procedure also, again, that I would want to align in terms of storage. They say you are able to receive or request additional tests if the sample is still available, if the sample has been stored appropriately. And in those instances, in those clips, we found the specimens were scattered all over the table. They are not appropriately stored as required by the standard procedure. So this could be also one of the highlights that SANAS actually withheld or suspended the certificate.
This list of specimens received by the hospital proves that the SOP is not followed.
This is one of the patient profile. It was a blood test that was taken from Bheki Mlangeni. Usually Bheki Mlangeni is codependent of NHLS Bara to result the test. So this test was actually requested on the 19th of March 2024, but it was then resulted on the 26th of March 2024. And you find that one of the tests is UNE and CRP, and those tests are actually time sensitivity, and they can actually be compromised due to having been tested at an overdue period. So these are one of the things that were actually seen within the lab.
The clinics within the township, depending on the hospital for test results, are affected.
Imagine umuntu omdala agibela going to the clinic and having to find ukuthi there are no results, and having to be issued ukuthi you need to do another test result again, and you find that it's a back and forth thing where they would still reject the specimen saying it's insufficient and unable to analyze. A bit of negligence within NHLS as well.
Cutting Edge recorded a conversation between a parent and a laboratory employee. The frustrated parent was sent by the doctor to collect her child's test results from the laboratory. It had been 11 hours since the tests were conducted on the child, who arrived in a critical condition. After going to the laboratory, the patient received the results and the child was diagnosed and sent for an operation the next day.
Sanibonani.
Yebo sir.
Ninjani?
Siyaphi.
Ma results eniwafuna wani?
Namhlanje ngaboma 11.
Ekuseni.
Yeah. Umntwana.
Bathi inkinga yekuphi wayengatholakala emini.
Awazi. Because nomunye uze la esinaye lapha ewadini.
Yebo.
Alahlekile wona wakhe watholakala.
Alahlekile.
Bathe alahlekile udokotela wow.
Oh, udonsa elinye igazi.
Yazi. So awazi.
Hayi bo, umhlolo ke lo. Angithi yabona sikhane singena, bona singene manje ngo-6.
Yeah.
Mangimangalele nokuthi nina ngo-11.
Loya wenze kuqala kulona lo alahlekile la ungakuhlola kodwa udokotela wasilethela lo
Manje akakwatanga.
kwati
Nawu kwatile.
What are these specimens?
One of the tests that were requested is CRP, which is usually C-reactive protein that is testing for inflammation or infection, and then UNE, which is maybe probably for analysis of kidneys. The doctor was frustrated because the results were not conducted or not processed in time, and these were actually agent specimens of a child.
The way that they are kept, you would be forgiven for thinking that these medical samples are trash. And this has been happening for a while.
It's not allowed for specimens to actually be mixed up, and you actually need to know exactly which date of arrival of the specimen so that you cannot delay any specimens on arrival to the lab.
How do they know which specimen come from which ward?
It has been found that ICU specimens have been mixed up. You'll find urgent specimens that actually the doctor has requested on the request form as urgent will be actually mixed up with routine test. And you'll find the doctor coming in looking for the specimen. We don't know the placement of the specimen. You don't know the date or arrival of the specimen, so it could be mixed up with clinic work and hospital work as well.
We obtained minutes of meetings from last year where doctors were raising concerns about the dysfunction in the laboratory. The health practitioner says although they are frustrated, other colleagues are afraid to talk about the state of the laboratory.
But why don't you know about all of this?
Everyone who's a medical practitioner is afraid to speak about this. No one wants to create a bad name for themselves or even lose their jobs. Hence, it hasn't been in the public.
However, some have anonymously vented their frustrations on social media. This is a complaint written by a doctor 2 years ago.
So what are these specimens that were asked by this doctor?
Okay, one of the tests that was requested is HB1C. HB1C is one of the tests whether you are diagnosing a patient or either monitoring a patient with diabetic. So this is actually how we have an importance of seeing if maybe a patient is regulated in terms of their glucose level. And then they also requested the rheumatoid factor, which is one of the tests that is conducted in order to see the traces of rheumatoid arthritis as well.
Patients have also had it with the ailing system. The NHLS says this is not procedural. However, patients at Chris Hani Baragwanath Hospital say collecting their own results from the laboratory is a norm, as we saw with the patient earlier. Does this mean then that critical life-saving medical procedures are sometimes put on hold?
There was a period in Bara where there was no longer doing transplant because of labs not producing or resulting or giving out results to doctors.
The health practitioner says the laboratory is short-staffed. Could some of the delays in testing and issuing results be attributed to the shortage of staff? When we requested interviews, both Chris Hani Baragwanath Hospital and the National Department of Health referred us to the NHLS. Although the NHLS claims that doctors often receive results on time, it also confirms that the operating license at Chris Hani Baragwanath Hospital has been suspended. The NHLS added that it instructed SANES to temporarily withdraw the laboratory's license. However, hospital employees say that they wrote to SANES requesting an investigation into the operations of the laboratory. It was after the investigation that SANES withdrew the license. It seems as though there's a lot of cleaning up that awaits the Department of Health before the National Health Insurance kicks in.